And hello again, everyone, and welcome to Art Fennell Reports. I'm Art Fennell. You know, it is that time of year again for the sniffling and the sneezing and the watery eyes. Do you have your tissue handy? Because allergy season is once again upon us. And if you are like me and you suffer from allergies, you no doubt already know this. It is miserable stuff. According to the American Academy of Allergy, Asthma, and Immunology, an estimated 40 to 50 million people suffer from allergies. That's roughly 20% of the U.S. population. And get this, allergies are the sixth leading cause of chronic disease in this country. And this season, well, it's been exceptionally bad already. With more now, here's correspondent Shelby Lynn.
Hello.
Many allergy sufferers started sniffling and sneezing early this year because of the warm winter weather. When we get warm temperatures during winter months, pollen and mold get released into the air earlier than normal, according to allergy experts, causing people prone to allergies to feel all of the typical symptoms from itchy eyes to stuffy or runny noses. Some scientists say global warming means the pollen count will continue to rise. In recent years, we've seen pollen seasons start several weeks earlier in many parts of the country and last longer. The pollen is not only more plentiful, but experts say it's more powerful and sticky, often making symptoms worse. Each region of the country experiences allergy season a little differently, but there are a few climate factors that can affect the severity of symptoms. Mold likes humidity and the heat. Grass and tree pollen like cool nights and warm days. Rain may wash away the pollen, but then counts rise quickly. Windy, warm days result in high pollen counts. Experts say the best way to prevent these symptoms is by getting allergy shots. I'm Shelby Lynn.
Dr. Segal is an allergy and immunology specialist as well. He works out of Chestnut Hill Allergy and Associates, located in the Philadelphia area. The doctors are in the house.
Yes.
You just heard that report, and I've got this box of tissue here handy because, man, we are really dealing with it right now. And there's some high numbers associated with this. Are you pretty busy right now, Dr. Segal?
We're extremely busy. This is the spring season is one of the busiest times of year for us. And that's because those trees are blooming and pollinating and making a lot of people miserable.
But let's deal with the symptoms of allergies. And they're pretty common, aren't they? I mean, it's the sniffling, the sneezing, the watery red eyes and so forth.
Right.
Is it as simple as that, or is it a little bit more complicated?
Well, Art, you mentioned a couple things. One is for most people, those over-the-counter allergy medicines help and they're effective and they take care of those seasonal symptoms. But for the patients that we see in our office, it's often the case that they come because those over-the-counter medications aren't working, and that's where they come for guidance. The types of symptoms that they may be having, typical allergy symptoms are itchy, watery eyes, itchy nose and throat, runny nose, nasal congestion, post-nasal drainage. And as Ira mentioned, one big reason that patients come see an allergist is it's exacerbating other underlying conditions like their asthma or chronic sinus disease.
Let's go over a couple of numbers because this is serious. You know, it's not just, oh, it's a discomfort and you know, we'll be okay, but it really does affect more than you might think. Take a look at allergy by the numbers. Just in the U.S. alone now, just in the new U.S. alone, the number of people in the U.S. who either have allergies or asthma symptoms, 1 in 5. 1 in 5. The odds that a child with one allergic parent will develop allergies is 33%. And the odds that a child with 2 allergic parents developing allergies now goes up to 70%. Absenteeism from the workplace and or missed work days due to allergies, 4 million people are out of work as a result of this. And the amount of money lost due to productivity or lack of productivity as a result of people suffering from allergies, about $700 million. And get this, one estimate of the annual cost of allergies to the healthcare system and businesses in the U.S., the annual cost, this has an impact of about nearly $8 billion. That's billion with a B. Dollars. So this is really impacting the workplace and a whole lot more. And certainly what you guys are doing is important.
Absolutely. When we think about children and how they suffer from it, we also need to consider how it's affecting their sleep, their ability to concentrate in school. Children who miss school means parents are also dealing with those issues and missing work as well. So you're right, there are some ripple effects from having some of these more severe symptoms.
Take me and a whole lot of other folks. Never into adulthood did I have any problems with allergies. Just fine. I'd see people complaining all the time. Oh, my allergies. I say, oh, that's too bad. You know, need some tissue. You'll be okay. Then out of nowhere, you know, probably for me, no more than 4 years ago, maybe 5. Pow! Why does that happen? And that happens to a lot of people I've talked to, that this hit them way late in life out of nowhere. What happens to us?
That's the $60 million question. So in terms of why an individual would develop sensitivities to some of those things, these are all parts of our normal environment that, as we discussed, 80% of the population isn't suffering from. So we don't really know what mechanisms turn on that allergic response. You mentioned parents who have allergies tend to have children who have allergies, so there is some role for the genetics. The environment may also play a role. So there are multiple factors.
Changing environment or so forth. And this is the bad news for you at home who don't suffer from allergies. You may be just like me. This may get you sooner or later anyway. Now it manifests itself in a lot of different ways. Like for me, the classic symptom for me, and I can feel this as soon as I step outside during allergy season, the pollens in the air from the trees especially, but also from the grass, and it triggers a sneezing mechanism right away. I don't get so much of the watery eyes, although I do get redness and so forth, but I get that sneeze mechanism from these trees and the blooming flowers and so forth right away. So it hits people differently in terms of if they're sneezing or if it's watery eyes or scratchy, itchy throat, which I don't get at all.
Acute and chronic symptoms. So the acute symptoms are that immediate onset of itchy eyes, itchy nose, sneezing. More chronic symptoms are referring to, which is more chronic sinus complaints, possibly headaches with more severe symptoms, chronic postnasal drainage, chronic nasal congestion, and less of those, again, more acute symptoms, which is the classic allergy symptoms you think of.
You develop this mucus that you've just got to blow your nose all the time because it's like you have the worst cold there is and you've got to keep continually blowing your nose. Well, what triggers that?
Sinuses have cilia which help clear mucus, and it's normal for that cilia to clear the mucus and for it to drain normally to the back of the throat into the digestive tract. But with allergic inflammation, you just produce a lot more mucus. It may be thicker and more difficult to clear, and that's what you're feeling is that drainage that would normally be there, but just more and more difficult. What the differences between a cold and allergies might be. So cold symptoms tend to come on more acutely. Maybe you've been around people who have also been sick, family members or friends. Those symptoms could be associated with more sore throat or ear pain. And typical cold symptoms tend to clear within 5 to 7 days. If your mucus goes from clear to discolored, that's another sign of cold versus allergies. Allergy symptoms, on the other hand, often people will give you a history of similar symptoms year after year around the same time. Also, the allergy symptoms tend to last longer, so depending on the season that they're suffering and what pollen levels might be like, it could last for several weeks to several months.
But you can't catch allergies from someone, correct?
Correct.
Absolutely not.
So you find yourself,
Right.
Oh, it's my allergies. And I'm not sick, I feel fine, but these allergies are killing me.
Right.
Dr. Manav Segal is here. He has a private practice located in Philadelphia, also an allergist and immunologist treating both adults and pediatric patients, trying to provide relief. Thank you again for being here. Let me give you some tips. on what you can possibly do to make your suffering a little less severe. First of all, try to stay indoors whenever possible, particularly when the pollen counts are going to be high. They'll tell you this a lot of times on your weather reports on TV and radio. Also, keep your doors and your windows closed whenever possible during the spring months, especially when the allergens are out. Clean the air filters in your home often, and the bookshelves and the vents and other places where pollen can collect. And then, get this, wash your hair after going outside because pollen will collect in your hair. And vacuum twice a week, if possible. And when you vacuum, wear a mask because that vacuuming is going to kick up the pollen and the mold and the dust that is trapped in your carpet. Just a couple of simple things there, but Doc, I'll say this. It makes you feel like you have to be trapped in your home if you want to try and beat these allergies. Is that even practical?
Art, listen, if you can avoid the things that you're allergic to, you won't have the symptoms, but you're right, that's not always practical. You gave some really good tips on how to avoid those things that you're allergic to. Some other things I might add would be wearing sunglasses, especially wraparound sunglasses, to avoid some of those eye allergy symptoms. Using cool compresses on the eyes because the eye symptoms can be particularly bothersome. And using a saline nasal spray can also be helpful in loosening the mucus and helping get rid of some of those irritants.
Well, you guys call these intranasals and so forth. All right, explain what we have here and what these are for, because I'm dealing with these in the middle here, and I don't know what they are. I've never seen this stuff.
Art, a lot of times what happens is people who come to see an allergy specialist has not seen really great results with some of the over-the-counter medicines that Ira was talking about, and in addition to antihistamines, maybe decongestants as well, or they're having side effects from those medicines. Then we move on to some of the prescription medicines, and one of the first lines in prescription medications is intranasal steroids.
These are sprays that are going to go in the nostrils. I'm just assuming
Absolutely.
Here these are all sprays
Right.
Into the nostrils.
Right.
All right, now I'm just being the antagonist here because,
Sure.
again, I suffer. And I know Dr. Rob Danoff, who we've had on this program
Right.
before, he's a big fan of these. These are these rinses.
Right.
What's this? Sinosense and
Right.
Nelly Med.
Right.
What
So these are a great non-medication alternative to treat your allergy symptoms. The advantage of these is these are available over the counter. They contain salt packets, and these contain a little bit of non-iodized salt and a little bit of baking soda. You put one of these packets in and mix it with some warm, sterile water, and the idea is to literally flush out that mucus that's causing the congestion and those allergens that are driving that inflammation.
That seems awfully, messy for one, and tough. I mean, you're going to actually take this and flush it out of one nostril through the other nostril.
Right.
And
There's some, you're right, it takes a lot of convincing to get people to use it. But people have been, maybe not in this fashion, but been doing the same thing for centuries.
But effective, though.
Very effective, and it comes in different delivery devices. So if one doesn't work for you, maybe another will. On this, you can see an image of a teapot, and that's where the neti pot gets its name. This is a more modern design, which is just supposed to make using it a little bit easier. You can lean over the sink and, again, literally flush the nasal passages.
Again, you got to do what you got to do when you're suffering and so forth. And the bottom line is you got to go see your allergist to figure out which of these is going to be the best practicality. There's a lot of stuff on the table here. There's a lot of stuff in the drugstores. And look, go see the doctor if you need extra care. See the pharmacist. They can talk to you about this, but you're going to need more than just these. This is just to help you when you got nothing else. Thank you, Doc.
Thanks
I appreciate
so much,
it.
Art.
See you again next time on The Report.